In this video, we will cover things that you need to know about acute coronary syndrome. Like all other tissues in the body, the heart muscle needs oxygen-rich blood to function. The coronary arteries wrap around the outside of the heart and supply blood to the heart muscle. The heart muscle requires a constant supply of oxygen to function. But what happens with coronary atherosclerosis? Atherosclerosis is characterized by the accumulation of fatty deposits, cholesterol, and other substances in the arterial walls, forming plaque. This leads to the narrowing of the arterial lumen and hardening of the walls, which reduces myocardial blood flow. There are two types of plaques in atherosclerosis, stable and unstable. Stable plaques have a thick fibrous cap and are less likely to rupture, while unstable plaques have a thin fibrous cap and more prone to rupture. So what happens in acute coronary syndrome? In acute coronary syndrome, or ACS for short, the plaque is typically unstable with a thin cap that can easily rupture. When this happens, it exposes the underlying contents to the bloodstream, triggering the formation of a thrombus, a blood clot. The clot can then cause either partial or complete occlusion of the vessel. In partial occlusion, there will be a sudden reduction in the blood flow to the heart, leading to ischemia or infarction. The clot can cause a complete blockage of a coronary artery, which will restrict blood flow to the heart and lead to a myocardial infarction. So in ACS, plaque rupture and clot formation can reduce or block blood flow to the heart, creating an imbalance between oxygen supply and demand, resulting in chest pain known as angina. Since the rupture of an unstable plaque is unpredictable, chest pain caused by ACS can come on suddenly. Patients can experience chest pain during physical exertion or even at rest. This pain is typically not relieved by resting and may get even worse. Acute coronary syndrome is a broad term for conditions in which blood supply to the heart muscle is suddenly blocked. It includes unstable angina, non-ST elevation myocardial infarction, NSTEMI, and ST elevation myocardial infarction, STEMI. Unstable angina and NSTEMI happen when the thrombus partially occludes the coronary artery, reducing myocardial blood flow without completely blocking it. Unstable angina occurs when blood flow to the heart decreases. It's not severe enough to cause cell death. The damage is reversible if blood flow is restored quickly, so it requires immediate medical attention. Since it causes myocardial ischemia and there is no cell death, the level of the biomarkers as troponin will be normal. However, in non-STEMI, the partial occlusion is severe enough to cause myocardial infarction and damage a portion of the heart muscle, but not the entire thickness of the myocardial wall. Because of the myocardial necrosis, troponin will leak into the circulation and troponin levels will rise. In the case of ST elevation myocardial infarction, STEMI, plaque rupture and thrombus formation cause a complete blockage of a coronary artery, leading to the cessation of blood flow and extensive myocardial damage. This results in a transmural infarct where the damage affects the full thickness of the heart muscle. As a result, myocardial necrosis happens and troponins, which are cardiac biomarkers, leak into the bloodstream and become elevated. So what are the ECG changes in acute coronary syndrome that will help us in the diagnosis of the different types of ACS? Let's focus on the ST segment, which starts at the end of the S wave and ends at the beginning of the T wave. Normally, it is isoelectric with the TP segment and represents the interval between ventricular depolarization and repolarization. Elevations or depression of the ST segment can be a sign of myocardial infarction or ischemia. Due to the extensive myocardial damage in STEMI, ST elevation will develop. This is followed by the development of abnormal Q waves. In unstable angina and NSTEMI, the ECG can be normal or may show T wave inversion or ST segment depression. However, there is no ST segment elevation. This slide summarizes the similarities and differences between the different types of ACS. As a quick reminder, unstable, and NSTEMI are caused by partial occlusion, while STEMI is a complete blockage. Unstable causes myocardial ischemia. In contrast, NSTEMI and STEMI cause myocardial infarction. Troponin levels are elevated only in myocardial infarction. Finally, ST elevation is observed only in ST elevated myocardial infarction, STEMI. Thanks for watching.